Hello, my name is Gage Ryan, and let me tell you about how the worst part of my life was found out in a McDonald's drive-thru. So, in seventh grade during middle school, I joined the cross country team, and I was one of the worst runners on the whole team. I was on D team. I almost got last every single race, but I was doing it in order to stay physically fit for my club season because we didn't play club during that time. So that day, it was a home race, and miraculously, I did amazing that day. And what better way to celebrate an amazing D team cross country race than a McDonald's drive-through run? So in the line, I'd ordered McNuggets, of course. My mom reached back and said, "You did amazing today," as she touched my leg as she turned around. And she stopped in the middle of her congratulations and said, "Your legs are getting really big. Is that from all the running you've been doing?" And I said, "Well, I hope so. I hope it's paying off in some way." I looked down as she looked down, and I noticed that my legs were obviously two different sizes. And this was an instant trigger for me and my mom. We rushed to the doctors, and then we were immediately recalled to Children's Mercy in downtown Kansas City. And this is how the worst part of my life began in a McDonald's drive-thru. And I feel like this is very relevant because no matter how small a situation seems or how weird a situation seems, whether it's in a big event or a McDonald's drive-thru, you need to take care of yourself no matter how small the situation is. And this is extremely credible because since that day, I've had over 30 doctor's visits in over 4 states because of this. And having lymphedema, which is what I have, has made certain parts of my life a living hell, especially from a social and a mental standpoint. And overall, throughout this speech, I will be telling you what lymphedema is and the differences between a primary and secondary lymphedema, symptoms of lymphedema, what I do to take care of my lymphedema, how I live with it, and what parts of my life are affected, how the doctor's visits have been since I've been diagnosed, and the surgeries. So first of all, what is lymphedema? The Mayo Clinic defines lymphedema as swelling that generally occurs in one of your arms and legs, sometimes both arms or sometimes both legs. It's most commonly caused by the removal or of the damage to your lymph nodes, which are located primarily in your head or neck region, but frequently swell in your armpit or your groin area as part of cancer treatment. Not obviously, but thankfully, I have not had cancer, nor have I had damage to any of my lymph nodes before, so it's very weird as to why I do have this. But your lymph nodes are crucial to keeping your body healthy, and they circulate a protein-rich lymph fluid around your body, which collects bacteria and viruses and waste products. And these substances are led to the lymph nodes, which filter out and flushed out of the body. Lymphedema occurs in the vessels that carry out these fluids but do not drain the fluids, which is why it sits in your leg, your arm, or any part of your body and causes to swell. So there are two types, primary and secondary, and according to Harvard, primary lymphedema is most common during early teenage years and is also most common in women. But the difference between primary and secondary is that primary is when the disease just occurs on its own with no other cause, whether it's because of puberty or genetics, and then secondary is when another disease or condition causes it. So I do have primary because I have not had any injuries towards my lower body or towards my legs in order to cause this, and I've been diagnosed with primary. And because I do have primary, I have a better chance of getting a cancer called lymphangiosarcoma, and that can eventually be deadly, which is definitely very scary. And the doctors have prescribed me with primary lymphedema because there's a disease called Meages disease or lymphedema praecox, and it occurs during puberty or pregnancy. And as a guy, I have never been pregnant before, and it was during seventh grade, which is about the prime for people to hit puberty or the beginning of your puberty steps. And with lymphedema come a lot of symptoms. In the picture, you see the stages of what lymphedema can do if it does get that bad as you get older. Thankfully, I would consider myself stage 1, possibly stage 2. But symptoms that do occur with me are swelling of my leg. I don't really feel heaviness, but that's one of the symptoms. My leg is tight. I don't have a restricted range of motion as I do play soccer regularly. I don't have aching and my skin is very thick. So things that I've done before to take care of my lymphedema include physical therapy or what they call this compression machine, and I have this exact one, which on the bottom picture pretty much just goes straight up your leg and it just presses and circulates the fluids, and while it presses certain parts. And physical therapy is pretty much just a real life version of this cast, just someone in real life doing it for you. And and then lymphedema overall has really hurt my social and mental health. I got it in middle school, and before I was referred to these physical therapy or compression cast, I was made to wear about 6 wraps along my leg that would go up to my thigh, and it looked about 3 times the size of my other leg. And during middle school, people don't really care about who you are or how your brain works, and I was made fun of a lot. And being a kid going through puberty and trying to figure out really who I am in middle school, it definitely hurt my image or my self-appearance or the way I thought about myself. And so since then, I've really been wearing pants or not trying my best not to bring attention to myself because of my leg, and it really has played a part of my life because I'll be in 100-degree weather and I will wear shorts. I'll wear pants, sorry. I just do not want to wear shorts ever. I have a story from when I went to go play soccer with my friends. It was about 100 degrees outside. Sorry, my dogs are barking. It was about 100 degrees outside, and I wore shorts for once, and I was there for about 2 minutes before someone had asked me about my leg or said, "What's wrong with that guy's leg?" And that just was another mind block for me into wearing shorts ever again. So I'm trying my best, and I'm doing pretty good recently, but it's just hard. And with all these doctor visits comes a lot of traveling. As I said, I've been to 4 different states, including Kansas, Missouri, of course, this is where I live, Minnesota, and Arkansas. I go to Minnesota a lot to go to the Mayo Clinic up there, which is a very prestige hospital. And I honestly haven't figured out anything besides the fact that I have primary lymphedema. That everything is a guess with them, saying that they think I got it through puberty or they don't think I got it because of this or this or this. And a lot of my symptoms don't correlate to the regular symptoms of lymphedema, so it's very hard for them to decipher what I really do and don't have. And that's just very frustrating for me to go through all these doctor visits and not figure out what I would like to hear. And at the Mayo Clinic, I have surgeries, and this video should load. So one surgery that I've already had on my leg is called lymphocovenous anastomosis, which is where they would put needles in my toes, which would shoot ink through my leg. And based on where the ink would be blocked by my veins is where they would make incisions and then reroute veins. And I was, of course, under anesthesia during this, so I was not awake. But it's honestly pretty cool if you think about how they can make incisions in my legs based on blockages and then reroute veins within it. So I thought that was pretty cool. And I am bound to have another surgery, which I have scheduled, and I have a video to show how this works.
A vascularized lymph node transfer. Plastic surgeons with special training use a surgical microscope to perform this advanced and intricate supramicrosurgery technique to treat mild to moderate lymphedema. While the patient is under general anesthesia, the surgeon makes an incision in the lower abdomen. With the aid of a surgical microscope, the surgeon carefully selects vessels and lymph nodes that will not result in lymphedema in the patient's leg. The targeted healthy lymph nodes are removed, along with the veins and arteries and some surrounding tissue. The surgeon carefully prepares the affected site to receive the transplant by removing the damaged tissue. The targeted lymph nodes are then transferred to the affected area, where blood vessels are reconnected. After surgery, physical therapy is continued to help improve the flow of the lymphatic fluid in the affected area as the body heals, with a goal to achieve reduced swelling, increased mobility, and improved physical appearance.